Hello and welcome to this video on Avanafil, a prescription medication used to treat erectile dysfunction, or ED. Erectile dysfunction is a common condition that affects many men, and it can be caused by a variety of factors such as age, stress, and certain medical conditions. Fortunately, there are effective treatment options available, and Avanafil is one of them. In this video, we'll take a closer look at how Avanafil works, its dosage and administration, potential side effects, and important precautions to keep in mind. Disclaimer: this video is for educational purposes only, and is not intended as medical advice. Do not take any medications without a prescription from a healthcare provider. What is Avanafil and how does it work? Avanafil is a phosphodiesterase type 5 inhibitor, which means it works by increasing blood flow to the penis during sexual arousal. When a man is sexually stimulated, the body releases a chemical called nitric oxide, which activates an enzyme called cyclic guanosine monophosphate, cGMP. cGMP relaxes the smooth muscle cells in the blood vessels of the penis, allowing more blood to flow in and producing an erection. However, the enzyme PDE5 breaks down cGMP, which can make it difficult to achieve and maintain an erection. Avanafil works by inhibiting PDE5, which allows cGMP to remain active for longer, helping to produce and maintain an erection. Dosage and administration. Avanafil is available in tablet form and should be taken orally with water. The recommended starting dose is 100 mg, taken as needed about 30 minutes before sexual activity. The dose may be increased to 200 mg or decreased to 50 mg based on the individual's response and tolerance. It is important to take Avanafil only as directed by a healthcare provider, and not to exceed the recommended dose. It is also important to note that Avanafil is not a cure for ED, and should not be taken on a regular basis. It should only be taken as needed, and not more than once a day. Possible side effects. Like all medications, Avanafil can cause side effects in some people. The most common side effects include headache, flushing, nasal congestion, and upset stomach. These side effects are usually mild, and go away on their own. However, more serious side effects are possible, including an allergic reaction, chest pain, and changes in vision or hearing. If you experience any of these side effects, it is important to stop taking Avanafil and seek medical attention immediately. Precautions and contraindications. Before taking Avanafil, it is important to inform your healthcare provider about all medications you are currently taking, as well as any medical conditions you have. Avanafil may interact with certain medications, and may not be suitable for everyone. It is also important to use caution when taking Avanafil, if you have a history of heart problems, as it can increase the risk of heart attack or stroke. If you experience chest pain, dizziness, or nausea during sexual activity, stop taking Avanafil and seek medical attention right away. Tips for using Avanafil safely and effectively. To use Avanafil safely and effectively, be sure to follow your healthcare provider's instructions and any other precautions listed on the medication label. Don't exceed the recommended dose and don't take Avanafil more frequently than directed. It is also important to use Avanafil only when you are planning to engage in sexual activity, as it is not intended for daily use. Before taking Avanafil, be sure to inform your healthcare provider about any other medications you are taking, as well as any medical conditions you have. This includes any over-the-counter supplements or herbal remedies, as these can potentially interact with Avanafil. Avoid consuming alcohol while taking Avanafil, as it can increase the risk of side effects. Also, avoid driving or operating heavy machinery until you know how Avanafil affects you. If you have any questions or concerns about taking Avanafil, be sure to speak with your healthcare provider. They can help you determine if this medication is right for you, and provide you with the proper guidance for use. Conclusion: Avanafil is a prescription medication that is used to treat erectile dysfunction. It works by increasing blood flow to the penis during sexual arousal and can help men achieve and maintain an erection. It is important to use Avanafil only, as directed by a healthcare provider, and to be aware of potential side effects and precautions If you are interested in learning more about Avanafil or other treatment options for ED, be sure to speak with a healthcare provider. Thank you for watching this video on Avanafil. If you found it helpful, please consider subscribing to our channel for more informative content on healthcare and medical topics.